I want to honor the gift for allowing me to join you in this press conference. And I want to say that it's good to be back on the same side with Reverend Al Sharpton. He'd been invited by President Obama for the two of us to go around the country proving on a bipartisan nature our commitment to education reform. And we made a number of trips together, and I have to say, I learned a great deal from working with Al. And it's good to be back working with him again, this time trying to save lives. You know, there are 100,000 Americans who are on the waiting list right now for a transplant. And 17 Americans will die every day because they can't get the organ transplant they need. Now, I take this very personally. I have a brother and a sister who've had lung transplants, and thank God they're both alive and healthy and leading full lives. I have a sister-in-law who has had a liver transplant, and she's doing very well, and she's having a great, wonderful life. And I look at these three relatives, and I think to myself, people that I love and that I so much cherish, where would they be if, in fact, they'd gone into remission, if bad things had happened? And I look at a test, which is right now being used to help people who've had transplants, a test which is non-invasive, which could even be delivered in your home, which allows us to detect very early if there's a problem of some kind. And unfortunately, there's a private contractor to CMS that has made a theoretical bureaucratic decision that it doesn't want this test given automatically. It doesn't want it to be given until you're in trouble. Now, that's exactly backwards. If you have the test, most of the time you aren't going to need the biopsy. And remember, a biopsy is invasive, it can be painful, and it risks infection. And it's expensive, and it's inconvenient. So I think from the standpoint of the patient who wants the best health at the lowest cost with the greatest convenience, because let me tell you, if you don't get the information early, if you can't intervene early, if you suddenly have either a rejection or a complication, or if you have a biopsy which becomes infected, you have dramatically greater expenses. I personally do not understand the rationale of this company which did the analytical work. I do not think they're right. And on behalf of my relatives and everybody else who has had or will have an organ transplant, I think it's important for the president to recognize that he has a rogue operation underway, and for the president to step in and say, wait, on behalf of the patients of America, I want them to have the best care, the best analytics, with the greatest convenience at the lowest cost. And I don't want some bureaucratic company trying to save money at the expense of lives, particularly when objectively it's not going to save money. It will cost money to stop us from getting the most accurate information as early as possible. I think this is an important press conference about a very human topic, and I hope everybody who hears about it will talk to their congressmen and their senators and let them know we do not want some bureaucrat cutting off the patients of America from the kind of care that they could have that will save their lives, improve the quality of their lives, and ultimately save all of us money. Thank you for allowing me to be with you.